From smartwatches tracking your heartbeat to fitness bands analyzing your sleep, wearable tech is revolutionizing personal health. These devices offer real-time insights, early warnings, and a deeper understanding of our bodies than ever before. But as we embrace this wave of innovation, a critical question emerges: who's watching the data that watches us? In this video, we explore the double-edged sword of wearable health tech, its incredible benefits for wellness and medicine, and the growing concerns around data privacy, surveillance, and consent. Is it a breakthrough for health or a step too far? Let's find out. Today, we will talk about wearable tech in health monitoring, boon or privacy nightmare? So before we get started, make sure to hit that like button, also subscribe to my channel. The rise of wearable health tech. Wearable technology has exploded in popularity over the past decade. It began with simple fitness trackers that counted steps and calories. Today, wearables include smartwatches, ECG monitors, continuous glucose monitors, posture correctors, fertility trackers, and even smart rings that can detect illness before symptoms appear. These devices are more than gadgets. They're miniaturized health labs you wear every day. They collect massive amounts of data, often second by second, painting a detailed picture of your body's functioning. For many, this real-time access is empowering. You're no longer relying solely on annual checkups. Your body is communicating with you constantly, and you're finally able to listen. Improved health outcomes through early detection. One of the biggest promises of wearable health tech is its potential to catch health issues before they become serious. Devices can detect irregular heartbeats, flag potential respiratory issues, or signal signs of stress long before you feel any symptoms. People with chronic conditions like diabetes or hypertension benefit immensely. Wearables can monitor glucose levels or blood pressure continuously, allowing for better day-to-day management. In some cases, they can automatically alert caregivers or emergency services if readings move into dangerous territory. This proactive model is transforming healthcare from reactive to preventative. And for many users, this can mean the difference between managing a disease and living with a crisis. Personalized wellness and lifestyle insights. Beyond medical monitoring, wearable tech is making lifestyle optimization more precise. These devices track sleep patterns, activity levels, hydration, and even mental focus. They offer tailored suggestions to improve your well-being based on your unique rhythms and habits. Want to know the best time to work out? Your wearable can tell you when your body is most ready for physical exertion, trouble sleeping. It can show you what habits are disrupting your rest. By providing specific, actionable insights, these tools are helping users develop healthier routines and avoid long-term health risks. This level of personalization, once reserved for elite athletes or clinical settings, is now accessible to anyone with a smartwatch or sensor patch. The dark side? Constant surveillance. But there's another side to this story, one that raises uncomfortable questions about surveillance, autonomy, and control. These devices collect deeply personal health data, often around the clock. And while users are the source of this data, they are not always in control of it. In many cases, wearable companies store this information on cloud servers. It can be used to develop better products, refine algorithms, or create marketing strategies. But it can also be sold to third parties, including advertisers, insurance companies, or data brokers, often with only vague consent provided by ethical dilemma. Is the convenience of real-time health monitoring worth the cost of giving up your most sensitive personal information? Data ownership and transparency issues. Who really owns your health data? In theory, it should be you. But in practice, the data collected by your device often belongs to the company that made it. Terms of service and user agreements, which most people don't read, often grant companies extensive rights over the data they collect. This becomes particularly troubling when that data is shared or sold without full transparency. You might think you're just tracking your heart rate, but that data could be used to profile your lifestyle, assess risk levels, or even influence the kind of healthcare you're offered in the future. The lack of clear, enforceable regulations around health data ownership makes it easy for companies to operate in legally gray areas and hard for users to protect themselves. Wearables in the workplace. Another frontier where privacy and wearables collide is the workplace. Some employers are offering wearable devices to track employee wellness, hoping to reduce healthcare costs and improve productivity. On the surface, this might sound beneficial. A healthier workforce is a more productive one. But it's a slippery slope. If employees are required to wear trackers, how much control do they really have? Could the data be used to monitor productivity, track movements, or even make hiring and firing decisions? The potential for misuse is real, especially if companies fail to separate health promotion from surveillance. What starts as a wellness initiative can quickly become a method of control, blurring the lines between encouragement and coercion, insurance, risk scoring, and discrimination. Health insurance companies are increasingly interested in wearable data. In some cases, they offer discounts or perks to users who share their data and meet certain fitness goals. But what happens if your data shows you're not sleeping enough, or that you're under too much stress? The risk is that insurance providers could begin using wearable data to assess risk levels, raising premiums or denying coverage based on data collected outside of clinical settings. This would be a profound shift in how insurance works, moving from actuarial tables and medical records to constant digital surveillance. Such a model risks discriminating against people with health conditions, disabilities, or simply those who prefer not to be tracked. Security risks and data breaches. In addition to privacy concerns, there's the looming threat of cyber attacks. Wearables, like all connected devices, are vulnerable to hacking, and the information they hold, medical data, location, biometric identifiers, is incredibly valuable to cyber criminals. A breach involving wearable data could expose not just usernames and passwords, but a person's entire health history, physical location, and behavioral patterns. The fallout from such a breach could be devastating, both financially and emotionally. And because many wearable companies are tech startups without robust cybersecurity frameworks, they may be more vulnerable than traditional healthcare providers. Regulation and the path forward. Governments and regulators are beginning to pay attention. In Europe, the GDPR offers some protections around data privacy and ownership. In the United States, new laws are being proposed to extend AIPAA-style protections to consumer health data. What do you think of our video? Let me know in the comments section below. Before you go, please hit the like button and subscribe to my channel. Thanks for watching.